Okay. So keep going. You're talking about binocular vision.
Oh, binocular vision, which I am not an expert on whatsoever. I can just tell you what I experienced. And I just know that binocular vision is a big deal. And
What is it?
I think there's a number of different issues that fall under the category of binocularity or binocular
Mm-hmm.
vision. And I believe it's just the ability to use two eyes equally together, like two eyes working together.
As a unit, yeah.
Yeah. And so, a lazy eye I think would fall under binocularity. Again, I could look it up, but I never memorized exactly what's in each category.
Mm-hmm.
But when I went to Lincoln in August, and I had already gotten glasses 2 years ago a year and a half ago for the first time. And I did not know I had a visual issue. This is the ironic thing. I was always saying, wow, I have really high arches. I needed orthotics. I needed dental intervention, but at least I didn't have any visual issues because I didn't.
At least I don't.
Yeah. Yeah. And because you don't know, because I was born with it. So it's not like I knew I needed reading glasses, because you can tell, like, oh boy, I can't see this anymore. So you get reading glasses, no big deal. But because I was born with a developmental visual issue, as a kid, you don't know that you're not seeing properly. I was born farsighted, which all children are to a degree. But as you get older, it gets less, down to like not very much. So right now, like my prescription is like a 2.0. Well, this is what I'm trying to figure out what my new prescription is. But my normal optometrist gave me a 2.0 in each eye, like contact lens and also eyeglasses. So everyone's born farsighted, but then it regresses to a normal level. And actually a little bit of farsightedness, I believe, is a good thing, because it allows you to have flexibility in your visual system. But mine never regressed. So I was farsighted without knowing it. So, because you're a kid, you don't know. And I didn't know I had to squint, basically. My mom's always like, oh, look at that look that you developed around 6 or 7 years of age, because there's pictures. She's like, you have a look. And people are like, oh, you have this look.
Yeah.
And I always told them it was me. Like, I get that look when I'm trying to process information. But what I was probably really doing was squinting. I didn't know I was squinting. I have pictures of myself when I was young, and I have this look. And my mom's like, so you had that look when you were 6 years old. And now I'm saying, I was squinting. I couldn't see.
And then when you squint, your neck comes forward, and then
oh my God,
it goes from there. Yeah.
If you look at my facial asymmetries, I was torsioned at like 6 years of age.
Oh my gosh.
I could never touch my toes. I could never sit in a long seated position without falling backwards. My back would be so tight. In elementary school, I would look at these kids like, how the hell are these kids sitting like this? I have always had to sit back. Couldn't do it.
So this was something that you had no control over. It was genetic.
You're born with it. It's interesting. My dad was so tight. He died of he had to get a hip replacement surgery, and then he died of complications afterwards. He was the tightest individual I've ever seen in my life. And he had back pain when I was young. And of course, I didn't know anything about this back then. But I am pretty sure he was PEC. He was patho-PEC. I believe I know I'm patho-PEC. And I'm pretty sure my brother's patho-PEC, but he will not let me touch it.
Runs in the family.
I think there is absolutely a genetic component to it. Because, I could see, I remember his feet, his arches were so high, and his toes, they would be like this. It's like they didn't even touch the ground.
Yeah.
He could barely move after a while. He was just so tight. And, he's in the end range of extension. He wore out his hip capsules, and he had to get a surgery. And then unfortunately he had what do you call it? Like not an aneurysm, but a blood clot.
Oh.
And about a month after, it was out of the danger area, that they say. But so there's like a month afterwards, or within a month, you have to be on blood thinners just to.
Of that specific surgery?
I think for a lot of surgeries like that, you have to be wary of blood clots. So you're on blood thinners. But he was outside of that, and it was just a freak thing. But so I was born with the visual. This is what I was told by Heidi, Dr. Wise. So she looked at my chart and my tests, and Ron looked at them. And to my optometrist, my normal optometrist, who's only checking for clarity because that's her job. Can you see? No. Okay, we'll put your glasses on you. She just said, you're farsighted, and here are some glasses. Now you can see. And it was revelatory when they put glasses on me in the optometrist's office. the regular optometrist, they put those glasses on me, and I was like, oh my God. Like all the tension in my head, like I didn't even know I was so tense. Well, I knew I was tense, but it becomes your normal, so you don't really notice it anymore. But the amount of relaxation that occurred in my body immediately was just astounding.
That quick.
That eyes, that's the thing. Eyes will overrule anything you try to do so quickly because it's processed at such a high level of your brain. It overrides something like 30% of your brain is devoted to visual processing. That's a lot.
Oh, I didn't know that.
Something along those lines. Don't quote me on that, but it's a lot.
That's going to be the podcast title.
Yeah, I don't think I'm exaggerating. I think I read that in a neurology book, in a neurology book. But either way, it's a lot. And I remember within 45 minutes, so I didn't have glasses when I left the optometrist's office, the normal optometrist, a year and a half ago. But on the ride home, they had given me starter contacts. So I had contacts in. It took me like 30 minutes to figure out how to put them in. It's so embarrassing. But as I was driving home, I started to feel my TMJs like fluttering. Like I could feel my face moving. I didn't know how to interpret though. I was like, something is going on here. It was literally my cranium was decompressing.
It's incredible.
And I remember making dinner and I was eating and my jaw popped real hard twice, like real hard, but there was no pain. I was like, wow, that's kind of weird. And then the next morning I looked in the mirror and my face had rearranged. Like my face literally became more symmetrical. Not completely, not as much as I wanted it to because I've been obsessed with it because I had that torsion face. But yeah, everything just dropped into better alignment. And then, because I was finally using both eyes at the same time, even though my right eye was still dominant, which I didn't know, I was still actually using both eyes for the first time. So that was amazing. Makes you feel the ground differently. So the reason I think my understanding of PRI in a way is different than people who haven't had my experiences, because I've experienced it. It's like you can know it intellectually, but when you feel the difference of how putting on a pair of glasses makes feel your arches on your feet so much more, and you feel the ground is almost like I had to get rid of my orthotics because they now became too high. I was sensing the ground too much because I was now actually sensing the ground.
Don't you have a story about when your right foot pronated, you felt like a pop and you got like memories? Was that you who said that? Who had that story?
No, I don't think that was me. I've had flashbacks.
Okay.
I've had some weird. I
think that's so cool. Like, what's the story behind that?
Oh, the flashback. Okay, so I've had two, and they both coincided with more. Oh, okay. So they have coincided with more pronation. That's interesting.
I see. Okay.
And if you say pronation, it means grounding. I was ungrounded. We're all ungrounded on the left side, at least a little bit. That's the definition of the left AIC pattern. You're ungrounded underneath your left heel. You're not sensing it. That's why a left hamstring gets you ground underneath that left side. So you can either get someone to feel their left hamstring. Their left hamstring in a 90-90, or you can just put them in left stance, have them sense their left heel, and you still get the same outcome. They're not stable, but you can inhibit the pattern. That's the important thing. So we're all a little bit ungrounded on that left side. So we have much more awareness of the right side than the left side, just because we're right dominant. And so the pronation thing. I remember when I was working on pronation, which means groundedness, the first time I had a flashback, I was actually reading a book about cranial. It was one of those cranial sacral books.
Oh, stills?
Yeah.
Those are awesome.
A lot of PRI concepts, like it comes out of that, like internal rotation, external rotation of the body. Like it's a lot of the same concepts. And I remember Ron saying, they just stopped short of seeing it as a pattern. It's like, they're not wrong. They just didn't see that it's a full pattern. Like it's a right stance versus left stance issue. And these patterns are coming down to this right dominance. And he's like, I learned a lot from, I'm pretty sure he would say that he learned a lot from that in the basic function and what can happen with the cranium and all these symptoms and everything like that. But they never saw it as a pattern. So it's not complete.
We're so close.
Yes, so close. If they just, and one of those books that I just read about the vagus nerve, he actually observes, the author actually observes that when he thinks an alarming thought, his top 1, 2, or 3 vertebrae, cervical vertebrae, would actually rotate out of position. He had his students
Really?
actually, that's the right TMCC pattern.
Yeah. That's so
But
wild.
people recognize these asymmetries. It's not only PRI that recognizes them, they don't
Yeah.
see it as part of the bigger picture. They don't know
Oh
what
yeah.
they're looking at. That's the thing.
I see it in so many books. I really do. I'll stumble upon something. I'm like, oh, wow, you just said it, but you're missing just one
You
thing.
just don't see it. Yeah, you just don't
Yeah.
see it bigger. Yeah, so there's a lot of great, and they just have to make that one leap to seeing that it's just part of a bigger pattern that they're not seeing.
Mm-hmm.
So with the flashback.
Oh, yeah.
So I was reading the cranial sacral book, and in it, they were talking about if you, and I don't go into anyone's mouth. I went to massage therapy school just so I could, for legal reasons, so I could lay my hands on people, not have to worry about stuff.
Yeah.
But so I'm not going in anyone's mouth. But I was reading that chapter, and they're saying you have to be very careful if you go into someone's mouth because people hold repressed memories, and dental work can be very traumatic, and all these things. And as I was reading, I start to feel this pain in my upper right molar area. And because I've meditated and I've been through the whole, just Buddhist psychology thing and just letting go of a lot of stuff that had occurred early in life. So I closed my eyes and I just kind of put the book down. And I just started breathing, and I got a flashback to being in the orthodontist chair. And I just had this visualization, and I remember the orthodontist name, Dr. Steinberg. He was a big guy, big hairy arm. And he had these pliers, and he was cranking. And that was my memory. And I couldn't breathe. My body started trembling, but I knew to stay with it because it was just something that had a process. Now, that's what they say. So I was like, all right, I'm just going to let it process. So I stayed with it. I kind of pressed my feet into the ground a little bit just to stay grounded. It was weird because I really couldn't breathe. Was
it like an anxiety response?
Absolutely. Yeah. But I think they would say, therapists would say, or more, I don't know if Western medicine would acknowledge these types of experiences, but certain Buddhists, more enlightened people, I would say, would certainly acknowledge these types of things. So yeah, it was a fight or flight response. It had to, I guess it got caught up in my tissue. I don't know, but after a process, so the tension finally decreased, the memory faded, and I was able to breathe more easily. And the interesting thing was I had no ability to breathe through my right nostril. And after that, I could breathe through my right nostril. I felt something had moved in my right cheek area, basically, in the right sinus area. And when I got up, I completely felt the ground differently. And that's really where I made that link between, it's almost like polarity therapy. Again, read polarity therapy. It's awesome. They just don't see it as big as a pattern.
So do you think it was like something, because you were reading about teeth, and then you felt your tooth? Like, how much of that is just,
I have no clue. I don't question things
beyond
anymore.
us.
Yeah, I've realized not to question stuff.
Yeah.
It happens. People are going to be like, huh? Fine with me. I really don't care. Because what I've been through in my life, one good thing is I don't care what anyone thinks. They haven't had my experiences. I don't have to logically explain my experiences to anybody.
Yeah.
It might be beyond our understanding. I mean, we're not going to know every single thing about the human brain and the human experience because we can't compare it. Everyone has their own individual experiences, and so who am I to say that this person had an experience or didn't have an experience? I don't know. They might have had something. Who knows what it was? Maybe a neuroscientist would say, oh no, it was just, synapses between neurons that were firing at a certain rate. Who freaking knows? I don't know. But I know what the result was. I could breathe through my nose better, and I felt the ground differently. So that was where that link between the cranium and the ground really made sense to me. And that what people are feeling underneath their feet, or how they're feeling their weight on their feet, will tell you a good deal about the pattern that they're stuck in. Because they're going to feel certain things. Weight on the outside of their right foot. It's just the left AIC, right BC pattern. That's a normal feeling. Weight underneath the arch of their left foot. Because if in the frontal plane, they're shifted. That's what they should feel. If they're feeling outside of the left foot, then you're like, all right, there's some pathology going on there.
Yeah.
That's just a frontal plane shift. It's so obvious. And I was obviously pathological. So, I felt everything wrong. So that was one memory. And then after I got pronation on my left foot better, which is necessary, just like the right foot, but with a pelvis that's positioned properly, I felt the left side of my face just expand. And I was at the park. I know where I was. I was at Taylor Park in Millburn, New Jersey, and I was doing this technique that I had learned in the integration, which is really a left glute med technique, where it's like a quarter squat just with the left leg, and you're holding on to your left glute medius and adductor the entire time. And I did that, and I don't know whether I made contact with my teeth or not. I can't remember. But I felt something shift. And I had those experiences before, so I knew something shifted. And I stopped by my mom's house a little bit later, and my mom, great woman, but she notices nothing. I mean, she notices nothing. And she looks at me and she says, "Why are your eyes blue?" I don't know what you're talking about. So I just went back to reading the newspaper. And then I saw my brother later on. He looks at me like, "Why are your eyes blue?" Because I usually have hazel eyes.
Wow.
And they change color. They're not like bright blue, but there's definitely a blue-gray tint around the edges that were never there before. I can't explain it, but maybe the shape the shape of the eyeball changed a little bit, so it's reflecting light differently, so it looks different color. I don't really know, but that was. Oh, and then later on, I had another repressed memory come to light later in the day, at night when I was sleeping. Actually, well, I wasn't really sleeping, but
cool experience.
Something let go from the old high school days, which I believe a lot of people. Craniums will tell you a big story.
Yeah, I think
when you're looking at torsions, you're looking at a story. You can't treat those people the same way. You gotta know about their life a little bit. So when you're really seeing major asymmetries in a face, not little asymmetries, because no one's symmetrical. But when you really start to see ears that are one higher than the other, and
I can't see that now. Yeah.
When you start to see it majorly, ask them where they're feeling their teeth. Do they have left molar contact? If they don't have left molar contact, you really got to be careful with them, because they're not going to be stable through their left side at all. Because molars are the heels of the upper body, and you'll see people that they have no ability to stand on their left leg. I mean, with both feet, they can't stand in left stance. The right foot's on the ground also, but they're very unstable. And then you do the old tongue depressor, or give them something in the molars, and they can stand.
Yeah.
Without being like this, or without extending their back. I mean, that doesn't really change anything, but it's given them stability so that they can actually stabilize on that left side. Yeah. So that's where, as you said, like when you take cervical revolution, it really changes your perspective on like, wow, that's why this didn't work with that person. Yeah.
When I was working at a PRI clinic in North Carolina, I saw some incredible things. Like, you do the tongue depressor thing, left molars, and then they can adduct. They're completely neutral just from doing that for a couple of seconds. I think like with the cranial and the vision stuff, like we were talking before we started recording, and how it's not that common, but the people it does work for, it works immensely well for. And I think that's why a lot of people get passionate about the PRI stuff, is because it works really well for a lot of people. Like in North Carolina, we had one of our physical therapists who got her tongue tie released, and you could feel her left glute med for the first time in her life, and so much of her pain went away. It's really just it's exceptional to see. And I think it's really cool that it's so integrated with the vision and the cranium and torsion. And I think that's such a useful lens for me now. I've taken that course to see how it affects and how it's all connected. But ultimately those primary courses still are the underlying.
Oh, yeah, absolutely.
You got to have those for sure. And as strength coaches, we're very limited in what we can do with the cranial stuff. I think it's good information.
Oh yeah. It's not for that.
We can't treat. So when it comes to like people who haven't taken a PRI course and people that might suspect there's something more going on, like what are some telltale signs that you might have an athlete or a client and it's like, I've done things with you that are basic and maybe even a little bit more than that, and I can't figure you out. Like you might have a vision or cranial thing going on. What would be some telltale signs?
Well, first, if you try any technique and all they're feeling, like if you're trying a 90-90 or maybe a sideline position, which requires a hip shift, if they're just feeling their back or their neck, or they're just not feeling anything properly, it's a good chance that their neck is involved somehow. Doesn't mean they're torsioned or visually driven. It just means it could possibly mean that their neck is overactive. And that doesn't necessarily mean it's something complicated. getting them a left ZOA could take care of that neck. It doesn't mean that they're locked into a cranial torsion position and nothing's going to work. But there are those people who they can't turn off their neck. So you just have to start with trying to get expansion of that rib cage, getting them grounded. You might try upright, like a wall supported, reaching type position, so that they can sense the pressure of the ground coming up and the wall behind them, basically giving their body giving their brain as much sense of security as possible to let go. Because necks will not let go until you can get grounded, until your brain, of course, you logically know the ground is there, but it doesn't mean your blind brain is sensing it appropriately because you've been in a pattern for so long.
Well said.
And the more you breathe with your neck, the neck pulls you forward and up and away from the ground. And you need to move down and back. But sometimes the neck is so tight, you can't do it. So, working on breathing mechanics can obviously be an important thing. They have to be able to expand their rib cage. If they can't, they're not going to ground. Telltale signs, you kind of just have to look at.
What about with vision? What would be like an indicator this person might have a visual issue going on? Is there any way we can tell without thorough assessments?
So what you can do, if you know what left stance is, if you get someone to stand in left stance, weight has to be at least 70 to 80% on their left leg. Get their right foot is slightly in front of their left knee has to be unlocked. A lot of them will stand with a locked knee, and if they do, they're in compensation. Their upper body has to be over their left side, because a lot of times they put their weight on their left foot, or they think they do, but their weight is, their shoulders, their upper body is still clearly over the right side. So you got to slide that hand down toward the ground a little bit to get their head aligned over the left side. Most people will be quite shaky at that point. They should be, because they're human and they have a less stable left side. So they should be shaky. If they feel like, no, I'm stable, they're cheating. I know they're cheating. And that's when I start to move their eyes around, and that's when they start to sway, because they're using their visual system to help stabilize their body, because they're so patho through that left hip where they just can't sense anything.
I see.
So it's like in a Bulgarian split squat or any type of exercise that you're doing, and immediately people stare at the floor, or they pick out a spot to stare at.
Yeah.
And it stabilizes them. If you ask them to move their eyes around, they become a lot less stable. So it's the same thing. People will use their visual system to help stabilize their body. They don't know they're doing it, but usually they become patho. But I think, doing if you know how to do are we talking about people that might know how to do some tests or no?
Sure, yeah.
All right. Well, find out whether they have pathology of that front left hip, if that extension drop test goes all the way down or not. That's a key, that if they're too pathological, good chance they might be, not that they might have a visual issue, but they might be using their visual system to overstabilize them. And that can be a problem, because that's going to keep their neck tight. Doesn't mean the neck won't turn off just through normal PRI stuff, but you might not be able to get that stuff going because the neck won't relax. So they have this, I call it the Death Star. They have this Death Star of sympathetic tension that won't let you access their muscles. You can't break down that force field because they're too tense, and they can't feel their left hamstring. They can't feel the right glute, and they can't exhale completely. And you can see them still tense, and their back won't shut off because they have that extra layer of tension that's preventing you from accessing those muscles in a more relaxed state. Yeah. And so if you like Return of the Jedi, you got to go down to the moon of Endor and blow up that shield generator so you can get into that. Yeah.
There's no amount of foam rolling that's going to solve that.
No chance. But that's all sensory. And so back to the left stance thing, you can just ask them to be in left stance. Head has to stay straight. You ask them to look down with their eyes. Head has to stay straight. You see how they react. Look to the right. If they look to the right and their body does this, which it may, they can't stay on that left side. Again, it doesn't mean it's a visual issue. It just means their brain is not comfortable with being on the left side and not using their visual system to help them out. Because now I just took them out of their compensation. All right? And then you look to the left, and at that point, a lot of people will be like, no, I can't do that. They can't be on their left leg and look to the left because they're accustomed to being on their right leg and looking to the right. You just flip it around on them. It's just like a normal pattern. It's You're basically putting them into like the right AIC pattern instead of the left AIC pattern. It's really not that much different. It sounds more complicated, but it kind of isn't. Because they're accustomed to moving their head and their eyes always over on the right side because they never get to their left. So you put them on the left, and when you look to the left, they might go back to the right, or they just might not be able, they'll look visibly uncomfortable. Yeah. Or I've had people get nauseous. I've had people start to fall forward and to the right, and they can't keep their weight on their heel. That's the pattern kicking in, trying to bring them back to the right side. That's when you really get a strong understanding of what these patterns really are. Like, they're not, like, these are real things. This person, these people cannot look to the left when they're on their left leg.
And you know what? Like, I think there's a lot of people out there that says PRI is too much of a one size fits all approach. What do you say to those individuals?
One side.
You know, like it's too much of like you put someone in this funnel of PRI and they're going to be right side dominant, and then all these things are going to trickle down. So they're going to need a similar approach. And that's with a lot of people. And a lot of people say that it's too reductionist almost. Have you heard that argument before?
I've heard that's too complicated, but I mean, the human body is complicated.
It is.
But this is the interesting thing. It's actually so simple. You have a right side and a left side, and the right side's too dominant. It's normally dominant. That's fine. It only becomes a problem when that dominance becomes excessive to the point that you can no longer use your left side. And now your rotation is compromised and you blow through joints, and now you're pathologic and things happen. I mean, I don't think it can get any simpler. Now, that's in theory. I mean, that's a much better way of explaining something than, you know, having 30 different possible pain syndromes for a shoulder.
Yeah.
I don't think it's complicated at all. In the big picture, it's almost too simple. But I haven't seen that it's not. I mean, I've never, we're all human. We all have a bigger right diaphragm. We're right. Yes. If you acknowledge the fact that you're right dominant and that there is a pattern, you really can't ignore the pattern.
Yeah. That's so true.
You either resolve, so you either acknowledge the pattern or don't acknowledge the pattern. But if you acknowledge that there is a pattern, then you have to treat the pattern. I don't see any other wiggle room for this.
Yeah.
Like you can't kind of go, well, I do a little PRI. Well, then you haven't really resolved the pattern.
You do that all the time. Yeah.
No, yeah. If you're not, yeah, exactly. If you're not working to resolve the pattern, you're like, oh, I'm just going to fix the shoulder without resolving the pattern. But the shoulder's hurting because of the pattern. So again, people can do what they want. I just see it. That's how I see it. I don't think it's simplistic. I think it's like Apple products. You know, simplicity is beautiful.
Yeah.
I think that's what Steve Jobs was all about. Like, get rid of all these freaking buttons, make it simple, and it's beautiful. That PRI gives you that model, and I think it is the most accurate model. Again, most people don't have visual issues. Most people don't even have cranial issues, but you do find them. Most people will respond amazingly well to the primary courses and impingement and stability once you understand how to use it. It's not PRI's fault that you never learned the neurology of the whole thing.
I think you hit a really good point about how when people like dabble their toes in, I think I've never really fully thought of that before in that way, but it's so true, because if you're not like 2 sets of a left adductor pullback 3 times a week is not going to get you anywhere. And that's what a lot of people do, is like they kind of dabble in, especially like people that are, you know, trainers and coaches. I see this a lot, but it's got to be like not gotta be, I guess, but like if you're going to use it, I think it's best used as a like broad lens through which you kind of look at things. Because if you understand these underlying patterns, then you know where people are ending up, and you can kind of like see with experience how people get to where they're at. So you can appreciate where they're at, but understand where they came from.
Absolutely. Once you see, like I joke with people about this all the time. Like, once you see the pattern, you can't unsee it. There's no going back.
True.
Like,
never. Yeah.
For me, I can't even have, I don't want to sound like a snob in any way, but I can't have conversations with people who don't see the pattern. You're just, you know, it's like an atheist and evangelical Christian trying to talk about the meaning of life. You're just talking past each other. Like your concepts of life are just so different. So Like, if you don't see a pattern, there's no way I can communicate what this pattern is because you've never experienced it or you've never seen it. I cannot not see, even my niece starts to see these patterns. She always pretends like she's not listening, but she's like, every now and then she's like, wow, look at that left shoulder.
Yeah.
That right SCM must be really overactive. She's like, see, Neal, I do listen. So she's like, I know what to listen for or what to look for. But if you either understand the patterns, it really sunk in, and like there's no going back at that point. I had my change of consciousness. There's no way. Like, people constantly tell me, oh, you should consider this and this and this, and I'm saying, but none of that's going to resolve a pattern. The pattern's the pattern, and you can look at individual areas of the body, but it's still part of the overall pattern. It's like there's no such thing as a lateral pelvic tilt. I'm sorry, there's not. I get more web traffic off articles that I wrote about lateral pelvic tilt, but they don't exist. All you're seeing is, you could look at the person's scapulars. Why don't they have a scapular pelvic or a lateral scapular tilt? Because I guarantee if their pelvis is tilted, so is their scapula. Yeah. Why do you call it a pelvic tilt instead of a scapular tilt? Because you're only looking at one area of the body. It's a total body issue, and it's just a visual representation of a pattern, of an underlying pattern. Most likely that a person is stuck on right stance. That right hip, if they're stuck there, that right hip might be higher.
That's very well said.
To the left, and it probably won't, as long as they can stabilize their left side.
I have a question. So something that's like kind of hot right now is the infrasternal angle. Do you care about the infrasternal angle? I know there's a lot of people listening to this podcast that are curious about that.
Oh boy. That's like the carb debate back in the day. It's you're like, I can just say that I've never looked at it. I know I'm aware of it. I just didn't even know it was a thing until maybe a year and a half ago. Because again, I just see it from my perspective. I only do PRI at this point. I'm really not much of a trainer. I'm not in a strength and conditioning setting. So if it's used in a strength and conditioning setting, I'm sure it could have some benefit. But from my perspective, in which is very sensory driven, because I know I can get someone neutral just by having them sense things. Doesn't mean they're stable at all. I'm just saying I can inhibit a pattern just by having them sense things. I actually showed that on one of my YouTube videos. It didn't really change all, the breathing strategy was stand on your left leg and breathe, and the right chest wall opened up, and now she was neutral. So that was a strategy. I guess it's just different. I just can't break out of the way I see it. So I can't compartmentalize the body or segmentalize the body. Like a rib cage to me is just no different than the lateral pelvic tilt issue. I don't look at that, a rib cage position is just to me. This is my opinion. I'm not saying anyone has to agree with me.
Sure.
Is just a visual representation of an underlying pattern. That's why to me, I never realized I was supposed to look at it. And I didn't know people were looking at it until not too long ago, but I wasn't going to change the way I was doing things, because in terms of getting people neutral, what I was doing was getting them neutral from a more sensory aspect. I just manipulate what they're feeling, what they're sensing. I take away what they're over sensing and give more of what they need to sense, and they go neutral very quickly. But that's what I learned in the visual integration course, was that this is all sensory. And I don't think people get to that point with PRI. Like, they don't get to that, I don't want to say level, it's just a change of consciousness where you stop thinking about muscle. I don't think about muscles and bones anymore. I do, obviously, I think about muscle and bones, but only in the context of, I know that it's sensory input that the brain is using to produce the output that you're seeing with those muscles and bones. And to change the function of muscles, to change their attitude, you have to change the input. You can't just change the muscle by its own. Muscles are dumb. The brain tells them what to do. You got to give it the right input to get that muscles to change. So again, I'm not against it. I just never used it, and I just don't see how it would fit into the way I'm doing things. But again, I don't work in a strength training facility. I don't have a team. I don't do any of that stuff. So could it be applicable to those populations? I'm sure it could. It's just that I never did it, so I'm not going to start doing it now.
That's an entirely fair answer. I totally respect that. I think you hit something that's important to talk about, and that is that as you get deeper, well, first of all, PRI is the ultimate rabbit hole, and it's really confusing at first, and the courses you walk out of there and you're fried. So it gets deeper. And I've never taken advanced integration, but I've talked to a lot of people who have. And they will tell me over and over again that PRI does go deeper into sort of the same kind of concepts that model does in the infrasternal angle. So really, like, I think PRI gets it and they talk about it and they get there eventually, but it's in an attempt to have them understand the underlying asymmetries and the underlying principles that they feel that are good to have as a basic understanding at first. But one thing that does, like, kind of, like, if you have a narrow infrasternal angle, for example, and then the idea is that you're compressed there and inhaled in your axial skeleton, they say that you should fog the glass on an exhale, for example, but you still should exhale. Right. So do you ever think about things in those terms? I know you don't use it, but does that make sense to you?
I will get someone to breathe in any way I can that gets their test to change. Because I just need something to measure it by. Like, how do you determine success or not? Like, how do you determine what is your objective measure of success in terms of how you make someone breathe? I don't really care how they breathe as long as they breathe and get the air out and their tests change. That's the most important thing. But that's how I've always thought about it. And I've had success doing that. So, you know, I'm certainly working on breathing. But I just don't have any specific strategies necessarily to attack specific areas of breathing, maybe. But I know I have to inhibit a right apical chest wall. I know I have to inhibit a posterior mediastinum. So it's all part of it. All those techniques are doing that one way or another. So I think it's just kind of built in. And, you know, in terms of, I've used the fogging the glass. I've used humming, kind of making it vibrate. Do it, because I don't want them to engage their neck when they're exhaling.
That's a good little, I like that, the vibration. Go into that.
Sighing. I try to get from deep in here so they're not trying to do it from their cheeks. So I just don't want them to use their neck, because if they keep using their neck, nothing's going to change.
I have not considered using that. I know there's a lot about vocal cords. I think that's been a topic of interest lately in the PRI realm. How does that play into what we're talking about?
Tell you the truth, I don't know. I'm not gonna lie, I don't know. I actually was. I was at. I was at the symposium where they talked about voice production. You know, are there people who are extreme patients who literally need to vocalize? Probably. They're probably traumatized. So I guess you also have to remember that PRI is coming from a physical therapy setting.
That's very true.
It wasn't for athletes necessarily. I mean, athletes are humans, so it's for everybody, but you always have to remember where it's coming from. I don't think that the hierarchy of PRI was like, this is for athletic populations. They're trying to resolve patterns. It might not be appropriate in the strength and conditioning world, because it really is sensory. We're trying to get people to stand on their left leg, rotate to the right, and breathe without compensation. That takes time. So maybe it's not so that works better in a physical therapy type of setting where you have time to do that. It's not going to happen with an adductor pullback and a breathing strategy. Not from that perspective. Not for resolving patterns. That's the difference. I'm resolving a pattern. Maybe, and that's probably not applicable, or not that's not applicable. It might not be feasible in the setting in which strength and conditioning people are living and operating. It probably isn't. It takes too much time. You can't do it with 5 people. You can do good stuff, but resolving an individual person's pattern, no, that's why you can't do it in groups. And not stay true to what it really is.
Yeah, I think that's a really important distinction to make. The fact that, there are people who have taken courses and they're like, I just can't do this. It's not feasible for my work environment. But at the same time, I think it's like, you can still take the principles of it And like,
Yeah.
that's what I do. I use that lens in the weight room all the time. Like just the gait aspect of it and training that in the weight room that's
Absolutely.
really changed the way that I approach things. But I love the point that you made. Like, yeah, like the way you use it and the way a strength coach approaches things are going to be inherently differently.
Completely different. Because I was a strength and conditioning person before that. And I had my crisis of consciousness, like, okay, how do I incorporate this into my training? And I think a lot of people go through that, where they're just like, I don't know what to do anymore. But then as you get more advanced in it and your understanding of patterns gets better, you realize you actually you can use left heel and right arch references with a lot, pretty much most exercises. You can always keep yourself slightly side bent to the left so you don't get pulled to the right. You can emphasize single leg stance exercises because most sports is on one leg at a time. You know, you're not usually standing on 2 feet and squatting or deadlifting when you're playing sports. So I'm not against it, but single limb training is more feasible in my mind to what we do in normal life. So, and realize that most people's left stance ability to stand on their left leg without compensation is severely limited. That includes great athletes. So is that something you want to take into account? Might as well. Doesn't mean you have to change how you do things, but just keep that in mind, especially if someone starts to be hurt. If they're hurt and they're injured constantly, then you might want to start to think about it and be like, you know, this athlete, he might need to see somebody who knows more about these patterns.
My old employer was a strength coach in ATC, and he told me this funny story about how he's a strength coach too. And he had this soccer team and he trained them all on only their left leg for 8 weeks or 12 weeks, something like that. And they all had remarkably better performance results. They were neutral. They were so much better than when he was training them more bilaterally, which I think speaks to a lot of things. Like he didn't even touch their right legs. And it's obviously an experiment. Would you do this in a real life setting all the time? No, but it was just an experiment. So I think it's really interesting that, like, to consider maybe we need to do a little bit more left stance work on just the left side. But also I think it's important, like a PRI thing that is obviously like we're in more of this right loading early mid stance on the right side. So just because we're in this, we're biased towards this position doesn't mean we're good in right stance either.
No, we're not. That was a big revelation.
So maybe we need to clear that up too. And that's something that can get missed.
Yeah. Right glutes are so important. And just because you're on your right leg a lot doesn't mean you're actually using that right leg appropriately.
Right.
Actually, that took me a while to realize. And also, I just wanted one other thing about infrasternal angles and settings. Like, I'm only working with people that are in pain.
Yeah.
You know, if your athletes or your clients, they're not in pain, then you can look at things in a lot of different ways. But I'm resolving pain. That's all I care about in my life, really, because I've been there. And I know PRI in its truest form is it's a system to integrate your senses in a better way to get you out of pain. So just remember, that's where it came from. That's exactly, from my perspective, I don't even know what people do in strength and conditioning anymore. I really don't, because I'm not around it. I'm just so not involved anymore. So you just got to remember, like, anything I say, you have to understand that my perspective is coming from treating pain, not from working with athletes. So again, it's kind of like an apples and oranges thing. There's crossover, but anything I say, you always have to remember it's coming from, I'm treating people in pain. I'm helping people in pain. I'm not trying to get them to be better athletes. I mean, maybe they will be, you know, as a consequence, but that's not my intention. My intention is to turn off an overactive pattern that is causing them pain.
Yeah.
But if there's other things that work well for people in different settings, I'm all for it. But I'm doing something very, very specific. And that's comes out of my personal experiences. So obviously I'm biased. Like, you know, I'm going to stick with what I know and what I do. I'm not against other things, but again, if it doesn't turn off a pattern specifically, and it's not addressing the whole body, it just doesn't register for what I'm trying to do.
I have something that relates to this. I have a friend who is in chronic pain a lot, and he was working with a high level PRI, PRC, and they did something interesting, which I had not considered doing before. I'd love to hear your thoughts on this. So he has like his left side is almost completely non-existent, like one of the worst cases I've seen in a long time. And tons of ligament laxity on that left side. Right side is like not great, but it's significantly better than the left. And this PT assessed him, and he'd tried so many different things with PRI before, but nothing really sticks. So this PT said, we're just going to put you in a left AIC pattern first. We're going to go after your right hamstring, right adductor, all that stuff, establish that left AIC position. Like, don't even worry about the left side. We're going to forget it now. We're going to get you to that normal human orientation, and then we're going to work from there. I've never considered doing that, but that makes sense, I guess, in the right context.
Oh, absolutely. Actually, other people, someone else used to ask me about that, and I only started considering that within the past year and a half, probably, because I have seen that people, again, just because like what we were saying, just because people stand on the right leg doesn't mean they're actually using that leg properly. Yeah. So if you think about patho-PECs, they don't have either side of the body. So yeah, you're probably going to you may want to start them with complete sagittal inhibition on both sides. And I know when I do my online stuff, I'm always testing people in a 90-90 position just to see what they feel. I'm not trying to get them to do an exercise. I want to know what they're feeling. And a lot of them, because they've been introduced to PRI a little bit and they know a lot of it goes into that left hamstring, when they're in a 90-90, like with 2 feet, sometimes they'll be like, I'll ask them what they're feeling. And they'll say, well, I feel my left hamstring, but not really my right. Like, oh, well, that's not normal. So, then that's not a good thing. I mean, it's good that you feel your left hamstring, but you need to feel the right also. So then I'll do single legs. And sometimes they'll take the left leg off and they'll say, no, I feel my quad. Okay. So I just reference them to a different area of their foot until they feel their left heel or until they feel the right hamstring. And usually because usually they're over-referencing, they over-sense the outside of their right foot. And if they do that, they might not have that right hamstring either. So I just maybe I'll bring them to the inside of the right heel instead of the outside of the right heel. And then they might say, oh, there's my hamstring. Now I feel it. All I did was change and this is why the sensory aspect, and it's not just an aspect, it's the whole thing, PRI. Like, that's why it's so important to understand, if you know what they should be feeling in a particular exercise or a particular technique, and they're not feeling it, it's because they're not sensing something properly. All you're trying to do is allow them to rest. They're not running a 100-yard dash, whatever the hell, I don't know if they still do those, but you're just trying to get them to sense their body in a completely parasympathetic state. Yeah. And they can't do it, but it's because they're not sensing something properly. And that's where those references, that's where impingement and stability is so valuable, to start to learn how to use that right arch and that left heel. And when you start playing around with altering their awareness to different parts of the wall that's underneath their feet, because when you say feel the right arch, you're not feeling the right arch, you're feeling the wall's pressure against the right arch. Because if you pick your foot up, your right foot, and I say, okay, feel your right arch, you're not going to feel a thing because it's in the air. Yeah. You have to feel things by feeling the ground pushing back on you. The earth moves you. We don't move on the earth. It moves us just as much as we move it or move ourselves. People who can't use the earth, they're tight. They're extended because they can't accept the earth's pressure. Left heels give you left hamstrings automatically if they're sensing it properly, and they can turn the right side off. The right arch turns off the right side on 80% of the people. So if they're in the 90-90 and you got a right arch and a left heel, they should feel their left hamstring without really any shifting at all.
How many years have you been practicing PRI?
7. Every stinking day of my life. Obsessed. Because it was my own life. I was trying to fix me. There was no way around it. It wasn't, like, I knew I had issues and I knew this is the path. So, but I'm not the norm. So I understand that.
It's the shift, like your mindset. I see when people have been doing it for around over 5 years ish. They sort of like, as they get more experience, the way they use language regarding PRI changes and the human body changes. It changes more to what you're talking about, rather than in strictly biomechanical terms.
Yes.
I'm a strength coach, so that's how I like to think of things.
Absolutely, yeah.
But that is the change I make. That's the Ronisms, right? That's how he speaks.
Yeah.
And I totally see it.
And I remember one of the first things that of course, I understood absolutely nothing. So if you think that I understood all this right away, I did not. I would just come home from seminar, like on Sunday afternoon of the second day of postural respiration, I'm just like, what the hell? I don't understand any of this. I mean, I was I knew I had to learn it, but did I understand any of it? No, I did not. You just have to be persistent, and if you can keep it in a grander context of a right side and a left side, if you cannot inhibit the right side, you cannot get to the left. If you're still feeling muscles improperly, it means you haven't inhibited the right side, and hence you're not grounded on the left side. So if I say grounding on the left side, it automatically means inhibition of the right side, because you can't ground on the right unless you're inhibited on the right. I'm sorry, you can't ground on the left unless you are inhibited on the right. Mm-hmm. So you have to get past A leads to B, leads to C, leads to D. And you have to understand that A, B, C, D are all feeding off one another. They're all happening at the same time. And that's hard because we're not taught like that. The human mind is not set up to think like that. It's thought up to think very linearly. A, B, C, D, E. It's not like that. It's all of it at the same time. And I remember one of the first things he said was, you orthopedic-minded people have to become more sensory-minded. And I wrote that down. It made no sense to me. I say that word sense all the time now. But it made no sense to me for years until I really had my own experiences when he took me out of my right torsion during one of the cervical revolution courses and put the $5 mouth guard in my mouth. And Sean was at this seminar, and he remembers. That's how I met Sean. And he had me get up off the table. And he said, just walk around the room. I put my left foot on the floor slightly. And then when I went to take a step, I almost fell. At that point, my life was turned upside down. I could never think in another I could no longer think biomechanically after that. And I think that's another important thing to understand. My experiences have caused me to realize this sensory, quote unquote, aspect that we're dealing with. I can't think in a biomechanical way anymore. In terms of rib cages and pelvises. Like, do I care about those things, that those rib cages can move and expand? Absolutely, absolutely. But in what I do, it's the sensory input that's going to allow that to occur. And when he took me out of that torsion, and I was so discombobulated, like I couldn't stabilize my body whatsoever, he took away my body's ability to stabilize, because it was doing it through the right TMCC, right torsion pattern. That's how I was holding on. I only had one eye. And he took it away. Well, he took my teeth away. Yeah. And now he didn't know I didn't have a functioning visual system, but it makes sense now, because I could never understand how I almost fell down. And one of the other instructors, Dan Hublum, he was in the class also. He's like, I remember that. And Sean remembers that. He emailed me a couple of days later. He's like, was that real? I was like, yeah. But I thought that was how everybody reacts, and it's not. I'm extreme. I had one eye, and I was stabilizing my body through that right torsion. That's how I stabilized my body. He took it away through the stomatognathic system. He took it away, and I stumbled. Yeah. And then I realized, wow, this is not what I thought it was.
What I tell people.
I stopped thinking about hamstrings and adduct. Do I think about them? Yes, obviously. But I know that they are a byproduct of the sensory system that tells them to activate or not activate.
What I tell people all the time is that you can't take these exercises off of Instagram, off of wherever, and then use them. You can't do it that way, because there are so many things you have to respect. You can make it look perfect, but unless you're breathing right, unless you're sensing the right things right in the sequence you need to do it in, then you're not going to really get anywhere with it.
No,
and I think that's sometimes what goes wrong when people say, I tried PRI and it didn't work for me. I was like,
well,
oh,
absolutely.
How did you do it? And they're like, well, I follow like 100 people who talk about it and I just formed, it's like, that's why. It requires such a high degree of concentration, at least at first, especially when you're coaching it.
Oh, yeah. And I sucked for my first 4 years.
Oh, yeah.
I mean, but you learn along the way you learn so much, like, why can I not get this person's test to change? Well, it was probably, now I know it was probably sensory. I didn't know that at that time. I mean, I remember the first time I used left peripheral awareness with some guy. It was a crapshoot. His right leg would not abduct. It just would not abduct. I was like, it couldn't get past like 10 degrees. How many more left sideline right glute maxes can I do with this guy? And it still doesn't change. Yeah. I was like, all right, let me just try this. All right, stand in left stance. Notice something out of your left peripheral vision. Breathe. All right, let's retest. And that was another one of my aha moments. I was like, all I had to do was have him sense his left peripheral vision. And if you don't sense your right arch, it means you're never getting to your left side. So you're going to drop off your left peripheral vision from time to time. And you realize left peripheral vision, right arch, right abduction, left horizontal abduction, the left shoulder are all related. They're all telling you whether a body is still stuck on the right side or not. And that's important to me. Like, that's how I see things. And they go neutral.
Yeah.
I can't unsee what I saw. So like, that's my perspective, and I can't change that to be more biomechanical. I just can't.
That makes sense.
But it is, but you cannot learn it off Instagram. That's why sometimes I'll post something just to get people thinking. My intention is not that because then people are like, oh, what can I do an exercise to address that? I'm like, not really. Like, how do I explain that to somebody? Like, there's no way. So, I don't want to be rude or anything, but there's just no chance, because I wouldn't have understood it for the first 4 years, and I was psychotic.
Yeah.
Like, you don't know anything about any of this. There's no way you're going to do one exercise. Like, it just doesn't work like that.
You're exactly right.
It's a discipline. It is its own discipline.
Yeah.
There should be PRI college. Really, it should be a 2-year school.
Yeah, that'd be great.
It really should. It really should. Like, you study to be a physical therapist and a massage therapist and all these other disciplines. In an ideal world, PRI would have its own college, and you go for 2 years, because it's not physical therapy, it's not massage, it's not strength and conditioning, it's its own discipline. That's what you got to realize. People are like, oh, I think I can just take 3 classes and know it all. Not a chance. Sorry. You have to be all in. You really do. To really understand what it is.
Yeah.
You need that change of consciousness, and that takes time, because we're so strength and conditioning minded.
Mm-hmm. And I think that can be off-putting for some people to hear, but I think you're absolutely right. And the best people that practice this have taken all the primary courses, 3, 4, 5 times, probably more than that.
I've taken cervical 4 times.
Yeah. Yeah.
The first time I understood nothing.
I can see.
I was crying. I was like, I don't understand any of this, but I knew I had to know it. And the second time, I got hints, I got glimpses. The third time, I was like, I think I kind of understand this. And then the fourth time, I was like, yeah, the left pterygoid is just like the left adductor.
Yeah.
They're no different. And once you see that, you realize you don't start splitting the body up into a pelvis, a rib cage, and a neck and a cranium. It's all one. It's all one. We just call them different things. You can't lose sight of the oneness of the body. The moment you segmentalize it, you're going to miss it. You miss the big picture.
Yeah.
And that's
what I first learned, that the sphenoid mirrors stance. That just blew me away.
It is amazing. And the temporal bones mirror the iliums.
Yeah, they're just a pelvis, like you said.
It's the same thing. I mean, if you know what the left AIC pelvis looks like, just put it on over your face, and that's the way the normal temporal bone pattern is. It's no different. And when you realize that, the whole left side of the body is an extension. It's like, oh, right side, left side. It makes it so much simpler.
Yeah.
But I guess you do have to progress to that point where that makes, like, because you can know it intellectually, and then, like, even now, there's still things I'll read, and I've known it theoretically, but it makes it like, I'll see it in somebody, and then it's like, oh, how did I miss that? Even though I probably read it 50 times, it just didn't sink in because it wasn't applicable to my life at that point in time. And now it is, because I saw it.
I know what you mean.
It happens continuously.
Yeah. Yeah.
Continuously.
Well, Neal, I appreciate you coming on, man. I want to respect your time and everything, but this was a lot of fun, and I think people are really going to enjoy this. This is a cool two nerds going at it. So this is awesome, man. Thanks for coming on.
My pleasure. I just want to say I'm not against anything. It's just you always just have to take into account different situations and different perspectives. And Absolutely. It's just what works for me may not work for other people because I'm in a different setting. And that's the important thing. Respect other people's experiences and other people's the lives that they live and the settings that they work in, because there just might be too much of a non-overlappable area you can't bridge that divide sometimes. And that's the important thing to realize when people are talking about different disciplines and rib cages and pelvises. Sometimes we just don't operate in the same sandbox, and you just have to respect that. So you just have to keep that in mind. Like, your subjective experience or objective is different than other people's. And so I do what I do, and I just kind of leave it at that.
That's very well said. And I think that's something that should be respected and absolutely makes sense. Thanks again, man.
All right, Connor. Thank you.